everyone, and thank you for the opportunity to talk today. And I hope finish on a bit of a high. And my agenda today is to try and empower you guys with some positivity and some tips and tricks, I guess, that I have gathered along the last 20 years of my career. And that sounds a bit scary to say right now, but I opened my medical school letter about 20 years ago. And look at, in the real world, understanding what you guys go through on a day-to-day basis. How can we actually teach you to build skills and knowledge around wellbeing into routine practice? What is that and how do we do it? Because I think that's the part of the agenda that's always missing. People say to diet, eat healthy, sleep well, exercise. But how do you do that in the lifestyles that we have? So I'm going to try and share some of the lessons that I've learned, I guess, along the way and am still learning. So I really want to bring this back to the positive. I think you heard this in the last session because there's been a huge amount of negative press about medicine. But I truly believe, and I'll stand up here today and say, I have the best job in the world. I have the opportunity to travel the world, to go home at the end of the day and have influenced someone's life for better. And when I went to Burma recently with some high-flying colleagues who do finance, law and some other careers, we actually reflected on our careers since school. And that was something that they didn't necessarily think that they could say, looking back. And there's this wonderful model that I found along the way when I've been looking at wellbeing called the Ikigai model. I don't know if any of you have seen this, but I think this is one of the reasons that explains why medicine is truly one of the best jobs in the world. And what it allows us to do is to have a sense of purpose. We get to do something that the world needs, and not every profession can always say that. We actually get paid very well, particularly in the long term, for what we do. Most people go into medicine with a true passion, and hopefully every one of you sitting in the room today, giving up a Saturday, has that same passion. And that will sort of wax and wane, and you'll develop new passions along the way. And medicine allows you to go into not just clinical sort of aspects, but a whole range of other things, and to keep developing those skills along the way. Over time, you get really good at this. And so I think as you go up the ladder, you get closer to getting into the centre of this model. And that's sort of the sweet spot that we're all aiming for in times. And you will move in and out of this sort of area. But when you're coming back to those sort of big questions of, why am I here? What's my purpose in life? Why am I doing medicine when all of this stuff is going on? Come back to this model and have a look and see where you fit into it and where things are maybe breaking down and that you need to focus on. The reality with our career, and I certainly felt this firsthand and still feel it on days, is that we have a very physically demanding and emotionally demanding job. That's part of the reason that we got into the game, because using that sort of environment, we can have a huge positive impact on people's lives. And that's hard to do if the stakes aren't high. But when the stakes are high, the pressures are high. And we're not necessarily armed with the skills and knowledge, I think, to be able to perform what we need to perform on a day-to-day basis. And that's particularly problematic in the junior years when you feel the brunt of this. No doubt many of you will look at all of these stresses and think you've experienced them at some point, and some will jump out at you more than others. Depending at what time of your career, if you're deciding what career to do, that can be really stressful. If you have exams to balance with everything else, that can be really stressful. If you have a life event that happens, someone dies in the family, life does not stop for medicine. All of these things can compound our day-to-day stresses, and at the end of the day can have a really big impact on us. We know not all stress is bad, and no doubt you've seen this along your training, and if you're watching the Commonwealth Games at the moment, you want to have that stress response, you need that adrenaline response to try and have optimal performance. So what is stress? Stress is our reaction to perceived demands on us. which leads to distress, and I guess this idea of perception. So distress occurs when we're expected to manage an external thing that happens to us in the environment that we perceive we don't have the skills or resources to manage. It overwhelms us, and that's what sends us to the right side of that curve. We know this is having a big impact, and you'll see the data out there, and this is particularly problematic in younger doctors, but I think also what we're starting to notice, and where none of the conversation has happened yet, is this is a big problem for senior doctors as well, your supervisors, and hence why the problem's being amplified across the system. So we know the system needs to improve. There's a whole lot of stresses that go with our job that we signed up for, but there's a whole lot of other system pressures that are amplifying those. We heard before some people, I think, talking about the individuals that go into medicine and our altruistic type A type personalities. So there are certainly individual factors and contextual factors, what's happening in the rest of our life, that determine what any stress's impact on us is at any period in time. And so this is the job stress model. And that determines that impact is the risk of illness, burnout, of all the things you heard about in that video. So what I wanted to focus on is, what are the individual things that you can do to try and empower yourself to not let the stress impact you as much as it could do. If we know what the factors are that are risk factors for stress and burnout, and I can tell you from looking after trainees for the last 10 years, the most caring, the most altruistic, usually females who stay back till 10 o'clock at night doing everything, are the ones that get into trouble. So the people that make the best doctors, in a way, and what community are after, are the ones that are high at risk. And that's one of the sort of perverse incentives and outcomes of our field. Most of us have never failed. When we come into medicine, and often selected into specialist training programs, you've never failed an exam in your life. You've never failed anything in your life. And the concept of that is terrifying. So when people are faced with that for the first time in their life, while trying to perform their day duties, there suddenly is a really big impact about that. And I certainly see that in the basic training audience all the time. We see people that give up their life pursuits. The blinkers go on, everything is about career, medicine, how do I get from A to B? And really I'm focusing on B and not the journey of actually getting there. And when I look back at the last 20 years, I don't know where that has gone. It has gone so quickly. And I encourage you to take stock and enjoy the next 15 years. The colleagues that you'll spend time with, the friendships to make, the patients that you will have a positive impact on. So that when you look back, you have no regrets. There's a whole lot of protective factors that we also noticed when we started to look back at the trainees and see which ones were being affected and which ones weren't. And I've listed them there. And essentially these were the things that helped us design the BPTOK program. What we noticed from all of that though, is that what stressed one trainee didn't touch another trainee. And so this is not a one-size-fits-all problem. And so I can't give you one medicine or one tip or one magic wand, like our patients often want, to fix this problem. What I can do is give you a series of things to try, and hopefully some of them will work for you. So what do we need to do to go forward to change the system? And you guys are a big part of this. We know we need to let go of the old ways, the old thinking patterns about how we do things. We need to change our mindset of we need to look after the rest of the world before we look inward and look after ourselves. To do that, we need to be open to learning new skills and knowledge that are not traditionally part of medical school curriculums. And at the moment, you might not have access to that. And so seeking where you can learn that knowledge is something you guys can do to take this into your own hands right now if you don't have a BPTOK type program in your organisation. You can learn these skills and knowledge in other places. We need to change medical culture, and we need you guys to help us do that. So we need to keep you well to be able to help us do that. And this has to change at all levels of the organisation, as we've heard today. So if we want to keep looking after others, and we need you guys to stay in the health system, we've got to learn how to take care of ourselves better, how to understand ourselves better. And what I'll convince you of at the end of this, hopefully, is if you learn to do that, you will be a better doctor. You will be a better human being. You will be there for your colleagues. You'll be there for your family, because you will recognise stress and distress in them, and you'll be able to help them manage that and the impact of that as well. So James asked me to give you some tips. I saw he only gave 5 for CVs. This is at least 3 times as important, so you get 15. And I had to really contain this to try and get it down. So what sort of tips? These slides, of course, are freely available to everyone. So the number one thing is this change of mindset, and I think your generation is definitely better at this. But whether or not you will step up and do it is to actually say, I will make my health and well-being a priority. And I will act on that. I will make my health and well-being a priority. So what does this actually mean that you need to do? It's going to be different for each one of you. One of the principles of BPTOK, when we're trying to explain it to people, is that we want to value new skills required to maintain health and well-being due training as much as we value in medicine other skills like CPR. And that's a really confronting thing to talk to senior colleagues about. To build that into training and into programs, and to convince you guys you need to do this when you think you should be studying for exams, has been one of the biggest barriers I found in implementing the program. And I wasn't expecting that, to be completely honest. So we need to convince you that this is a priority. Tip number 2, once we decide, okay, let's make our health and well-being a priority, training years are difficult, and we need to surround ourselves by a support crew. And that's going to be different for every one of you as well. And it's going to be outside medicine and inside medicine. One of the things we saw with the protective factors, if you have good networks and you keep them over time, and you might have them now, because in intern and residency, sort of things starting off, and it's when you go into those specialisation years that things tend to fall away. So we need to prioritise it and make time to keep our network strong as we go forward through training. And I'll share with you some strategies of how to do that. Tip 3, they've got a cool slogan. So now make sure your support crew has a GP in it, because they're your specialist in life. So now it's hip to have a GP. Right? I joke, but it's a really, really serious thing. The first time you need to see a healthcare professional or a GP, you do not want that to be when you're suffering from a mental health problem. That's a really confronting thing to have to do. And as many of you will know, it takes time to build trust with GPs. And you might go through a few before you find the right one for you. Start that process now, so that when you need them, they are there for you and you feel comfortable going to them for everything. How do you find a GP that's okay to treat other doctors? The honest answer is it's difficult, and I think word of mouth is probably one of the most important things. Speak to your colleagues, start that conversation. The AMA has got on their website now doctors who have put up their hands and said they're comfortable to treat other doctors, and they've done it by area. So you can go to that resource. If you don't have one, and I won't get you to put up your hands, make sure you get a GP going forward. There's a whole lot of screening that you guys will be learning that you tell your patients to do. Step up and value your own well-being and start this process today, not in another 5 years' time when I tell you it gets much harder. The 4th tip is to make sure that your support crew, so you've got friends, family, you've got GP, you've got your colleagues, make sure you build some mentors in. We saw in the video some very distressing events that happen. And what you truly need to be able to do if that happens is to be able to debrief with someone that you trust, that is more senior in the organisation, that can help you navigate really tricky things that can happen. So mentors are another thing, and for many of you, if you came to the AMSA, I don't have a lot of time to go into how to do that today, but we recorded a really nice podcast on the wards that you can go to, and there's a whole hour of how to do this going forward. The fifth tip is the converse of that, and this is something I learned later in my career, is that your support crew is there for you. And if we all have this pay it back, pay it forward type system, mentoring someone else is actually a really, really valuable thing to do. It makes you feel good. So it improves your well-being. You are helping someone else that's not in the patient context. It helps you become a better mentee yourself. And so your mentee-mentor relationships are far more likely to work, because not all of them do. So if you have the opportunity in any of your organisations, or you have the ability to set up programs, put up your hand to become a mentor as well. Even at the junior level, you guys have a volume of information that those below you really want access to, and you can help them navigate the system for the first few years. The sixth thing that I didn't realise how terrible we sort of all were, and I certainly put myself in this bucket, is that we don't necessarily always recognise the symptoms and signs of stress very easily in our colleagues. We saw in the video a very mean registrar. Most of us that sign up, in fact I'd hope to say all, to do medicine are there for good reasons. When behaviour starts to go off track a bit, the first thing I'd want to be asking is, are you okay? This guy's giving me a really hard time. And if you tried that on the registrar who's giving you a hard time down the phone, just stop, pause and say, hey, are you okay? Imagine the response that you might get. Try it and see. But imagine if we did that, every one of us did that for each other going forward. We're not bad people. We do bad behaviours sometimes, but there's usually a reason for that. And the stress is usually the thing that's driving that, and we all go through the same system. So learn to recognise it. Now, there's different stress reactions. So what I'd like you to do is to just think about, you can write down if you have a piece of paper, but just think about 3 simple physical reactions, and you'll all be a little bit different as well, that are your stress signs. They sort of give you that red flag, hey, something's going on here, not quite right. Have a quick think about that now. Off the back of that, and sometimes this is a little bit harder, think of 3 feelings that you might have that might say, I think I'm a bit overwhelmed at the moment, stress is becoming a bit distressing. What are the feelings that you have that if you recognise you'd go, stop, check, need to do something about this? And then as we saw in the video, hopefully they're not your behaviours. What are the behaviours that you might notice in yourself? What things do you start to do when you get a bit overwhelmed and stressed? I can tell you your partners will be able to tell you. Your family will be able to tell you. Do you recognise them early when you're doing them? Here are some of the common ones that you can see there. And see if any of yours are in there. Some people always get headaches when they get stressed, and that's quite common. Some people get belly pain for some reason, and they don't get headaches. Everyone will be a little bit different. And what I want to bring this back to a little bit is this is what we're seeing in our patients as well. If you recognise this in yourself, you'll start to recognise it in others. You will be a better doctor, you will be a better colleague, you will be a better human being. Tip number 7. The magic wand theory says, don't put all your well-being eggs in one basket. So don't think that you're an exerciser, and so that's the only thing that you'll ever need to do to maintain your well-being. You need to arm yourself with a series of strategies from different parts of your life, and I'll show you a few of those in a moment. I probably use 5 or 6 on a routine basis that I find work for me. And I probably tried 15 to get to that 5 or 6. What are some of these strategies? Puppy dogs fix everything. Outside work, social connection, touch, happiness, cuteness, laughter, comedy, exercise, different breathing, yoga. All of you will hopefully partake in some of these. All of you at risk of stopping these as you progress through training. Don't let it happen. And if you don't undertake these, think about doing it in the near future. Take your ADOs. There's this sort of culture of wanting to save them up and get paid extra or use them for other holidays and things. They are there for a reason. Having that buffer on a regular basis that just takes the pressure valve off is a really useful thing. When I don't have time to go to the doctor. Take your ADOs. The system tries to make that difficult for you. We are trying to conquer that now, and we're trialling non-clinical terms that have been incredibly successful. So we're hoping that's going to sweep through the system. But at the end of the day, you've got to be proactive. If you plan it ahead, plan it with your term supervisor, you are entitled to them. Take your ADOs. 12 days over the course of the year really adds up when it comes to stress levels. Take your holidays, don't save them. Again, the pressure valve, you don't realise it sometimes builds and builds and builds. And if you just had, the amount of people I talk to haven't had a holiday in 2 or 3 years because they wanted to use that time to study has been frightening. Don't let that be you. Sometimes we think we're doing the right thing and we're our own worst enemy in terms of our well-being. One of the other things that I think is a really big thing that society struggles with, and if you think the health system is just a micro ecosystem of society, is conflict management skills. I think we're all pretty terrible at this. And we don't really get any training in it. It's something in the hidden curriculum you're just supposed to pick up along the way. It's in every industry. When you go to a cafe, you'll see it all the time. Unfortunately, society's values change and there's a lot of conflict out there. If you can find a way to do a conflict management course, learn how to de-escalate those situations, it's a really valuable skill. Tip number 8 comes down to the deep breathing, and I put this one in because it was like a light bulb moment for me about a year ago when someone showed it to me. It's so easy, and hopefully many of you may even know about it, but it's a really simple, quick thing you can do to lower your stress immediately in stressful situations. So I'm going to get you all to do it now and show you and open your eyes to something that I thought was amazing. And I use it all the time now in little micro moments. Before I get a big talk on camera, I use this technique. Before you're going to go into an exam, you can use this technique. You've had a hostile interaction for whatever reason with the emergency department, you can use this technique. Someone's just talked to you on the phone in an inappropriate way. You want to answer back, use this technique. So what is this magical technique? You need 2 hands. So it's all based on vagal theory, and we know the vagus slows the heart rate, calms the body, calms the system, and it's really quick the way it does it. The way you activate your vagus is actually to bring the diaphragm right down. So you have to do belly breathing, and it's got 6 steps. To do it, put 1 hand on your upper chest and 1 hand on your belly. And the belly one's the most important one because not many of us belly breathe. When we're really stressed, we shallow breathe, so we only use the upper part of our chest. When we're relaxing, we do the belly breath. So what we want to do is take a big breath in over 5 seconds. Do it now with me. 1, 2, 3, 4, 5. Hold that breath. And now breathe out slowly. 1, 2, 3, 4, 5. This time, make sure your belly comes right out, so push out with your stomach muscles. Breathing in, 1, 2, 3, 4, 5, and exhaling, 1, 2, 3, 4, 5. Now we've just spent 20 seconds or so doing that. You notice any different feeling that you've had already? You can keep doing that until you achieve the state that you want to achieve. It's such a simple thing. People build it into other practices like yoga and other things, but you can simply do that and you can check yourself, reduce your stress levels, take a step back, slow the heart rate, reduce the anxiety. It's a really, really useful thing to learn how to do and be able to do it on command when you need it. Tip 9. This is something I have really struggled with and I've been reading a lot about lately, and we've got some new tips because social media is destroying society, it's destroying our ability to interact with each other, and it means for people in really busy careers, we are never off, and we are living in a false economy of what Facebook tells us is the real world. How many times a day do you check your phone? Someone asked me that and I thought 30 or 40. So you can get these apps now called Moment or Checky that will tell you how many times you check your phone. Anyone done that? 240 times was my result. Got a problem. You can also look at how often you check other sites. So it looks at, you said it, how often do I look at social media? How often am I emailing? How often do you get home and you're on the couch watching TV doing this? You're not even looking at what's there. Why do we do that? We are never ever off. Our poor brain is like a muscle. You go to the gym and you never give yourself a break, what happens to your body? The brain is exactly the same. If you are never off, your brain starts to fail, as would any other muscle. So give yourselves a break. What did I do? The simplest thing I did was I turned off notifications. So my phone didn't light up every time someone sent a WhatsApp or a Twitter or a Facebook message. And so I stopped having that first jerk to say, oh, what am I missing? What am I missing? So that was a really simple thing that worked for me. I'm trying not to use my device in bed. The only way to physically do that for me is to have it out of reach. So I charge it now on the other side, and because I set my alarms and everything with it, it also forces me to get out of bed in the morning to turn it off. So you get two good things out of it. Try that and look at, once you see how much time you spend on these things and how little real social connection you're having, you'll get all this time back that you think you don't have. And certainly that's something that's helped me. The 10th one, and I wish society would do this, but as a doctor, and to be honest, as a family member and as a patient, when you remember the doctors that made a real impact on you, it's usually some small act of kindness that they did. So I can tell you, when I was unwell and had someone looking after me, the one thing I remember from this very revered person was that they noticed I had a cold cup of tea on my bench, and I was dying for that cup of tea. And they went and got me a hot one. This was some senior specialist that clearly wasn't their role. And so I must say, I've tried doing that, paying it forward to patients now, and you should see the way they light up. These really small acts of kindness or compassion is not what the system's allowing us to do on a routine basis, and yet it's what our community and our patients are craving. And I promise you, it will make you feel good. Your wellbeing meter will go up. If you do nothing else and you cannot save that patient, you cannot fix their pain, you will actually reduce their pain by doing something like giving them a cup of tea or a blanket if they're cold. Tip 11 is about enjoying the journey. So I alluded to this before. One of the parts of the BPTOK workshop that we do is about reflecting on the things that are most important to you in life. So if you think now, what do you value most in your life? Top 3 things. Most people will say family, friends, health, career, something like that. How much time do you currently spend on those things? It's quite a confronting thing to have a look at when you look at the thing you truly value in life and then how much time you spend on them. And when you lose sight or you lose perspective, it gets very easy when one part of your life is not going very well and you haven't devoted any of your time to any other part of your life to feel pretty miserable. So don't forget that and build that in to your training along the years. Don't forget to keep those social connections. Make time for your partner once a week. Make time for your family. Tip 12 is on the AAA type personality. And I struggle with this one, and my mentees have certainly struggled with this one. Give yourself a break. So my line to my mentee last year, and I hope she doesn't mind me telling you this, is 98% is okay. Don't go looking for that missing 2% every time. It's exhausting. You cannot go through life like that and function at a high level all the time. You're going to make mistakes. You're human beings. You're junior doctors. You are meant to make mistakes. That's okay. It feels terrible, but it's okay. And you need to talk about them when you make them, because the people you talk about them with, and this is where your mentors come in again, have all made them ourselves. I always say to my juniors, I don't care if you make a mistake. What I'm going to measure you on is how you respond to that. And society will do that as you go through your career. And that is what ends up being the things that influence those senior doctor appointments. It's not the CVs and things that you think in the junior levels. I can tell you that now as a head of department. The other thing someone told me when we ran a wellbeing session a couple of weeks ago, stuck with me, is that we're always comparing, we always have to do the best, because that's the way we're wired. And they said to me, comparison is the thief of happiness. You are never ever going to be good enough if you are always comparing yourself to others. So don't forget that. Don't rob yourself of that happiness. Oh, I did a really good thing, but I should have done this better. Whenever you ask a junior doctor to self-critique, they always go to the negative. You've got to force them to say the positive. And then you go, no, tell me something good. They'll tell you one positive, and then they go back to the negative again. We're very, very bad at reflecting on the positives in our life and enjoying them. That makes the journey hard to enjoy. Tip 13 we are working on right now in the organisation, and I am terrible at this, so do it, but I haven't really found the complete solution yet. Find a way to have 3 meals a day. So we've just done a survey in our hospital, and we find junior doctors do not take lunch. And we know a lot of the barriers to that. You get interrupted, there's no time, patients get sick, you feel like if you're off the ward, you're not working hard enough, all those sort of issues. Forgot to bring my lunch today, it's too far to go to get it, I'll just wait till I get home. Is that resonating with some of you? So how do you eat well? First thing is to prioritise it, like anything. Sunday preparation is the key. If you haven't worked this all out, you have to prepare Sunday and your week will work. If you miss the Sunday preparation, working Sunday, have to do it on Saturday, then it's much more difficult to do in a time-pressured schedule. You can look at different ways and online ordering systems and things if your finances allow you to do that. But you have to prioritise it to even want to do it, to make it work and recognise it's a problem. If your residents aren't doing it and you're not doing it, your interns aren't going to do it. And I say the same to the registrars and the senior staff, who will sometimes come and ward round in the middle of your lunch break. So what are we trying to do now? We're trying to make this a patient-centred process. So when the patients get their meals on the ward, the doctors should not be interrupting them. They should be off having their lunch. So we're going to try and combine these two things together to be better for patients, allow you to get off the ward and have your lunch, and put a notification with our nursing staff that you're not to be interrupted during that time unless it's a clinical emergency. Imagine that. We can set a new precedent. We can change culture. Just because it was never done before doesn't mean we can't do it again. You guys are a big part of that. These ideas have come from the JMOCE committee that we run at the hospital. Tip 14, we're getting close. Tip 14 is, in some capacity, and I know this will horrify some of you, try and build some form of exercise into your daily life. That might be a walk on a Saturday morning with your friend to get coffee. You then get social connection, you get outdoors, you get to get some exercise. Try and build it in. People always think exercise, I don't have an hour, I can't get to the gym, I can't do it. What we're trying to teach our lot is you can do a 10 or 15 minute session and be absolutely out of breath, not need any special equipment, and do it in any environment. You just need the knowledge and skills to know how to do it. So there are things called EMOMs. Every minute on the minute you do an exercise. You do that for 10 minutes, you're exhausted. Build that in 5 days a week and suddenly you've got a clearer mind, you've got more energy, you sleep better, your wellbeing index goes up. There's very little things that you can do to make a big impact over a period of time. Have a buddy. Let someone down if you don't turn up. That one worked for me a lot. Because we like to please, most of us in medicine. The last tip is about, okay, I've given you a whole lot of tips. How do you actually make that happen? It relies on tip 1, which is that you're going to value this and prioritise it and make an agreement with yourself that you want this to happen. It's like not pre-contemplation, like giving up cigarettes and things. This is the time to empower you and make this happen. I want to change, I want to build this in. So how do we do that with goal setting? It's good for you, good for your patients. So there's this very nice technique many of you might have heard of called SMART. So we teach it, and it's good because when you learn to do it yourself, you use it with your patients to target set with them. When you're trying to help that overweight patient lose weight and you want to give them specific, maybe 1 kilo, try and lose 1 kilo and make it achievable, half a kilo in the next month. Something you can measure, so that's an easy thing. Something that they're not going to fail at, don't set yourselves up to fail, so make it attainable. Something that's realistic and something that is timely in that you're going to see a change in the near future because otherwise you'll lose motivation. So SMART can help you build anything into your life that you choose to, and it's all about scheduling. So when we do teach people how to teach, we say teaching is a planned activity. Goal setting is also a planned activity. You have to sit down and think about it to do it properly. So you need time, energy, and thought to go into it. When you're thinking about this, think about all the things that I guess we've talked today and all the different parts. If you want to build seeing your partner into your schedule, how are you going to actually do that? What are the barriers to it? How will you know if it's worked? When are you going to review the process? So these are the sort of charts that we use that we get people to fill out when we're designing their wellbeing goals. We have asthma action plans, we have insulin action plans. Why don't we have the JMO wellbeing action plan? And each of you need to come up with your own one because they're all going to be vastly different and they're going to change over time. So for example, if you're someone that doesn't have a GP like this person, the goal is obviously to not only get a GP but to see them once. That's a really specific goal. The time frame, okay, hopefully you do it soon, but let's make it realistic so we don't fail. So this person's given themselves 2 months. Think about what the challenges are, your own reluctance, time. Do you need to use the ADO to do it? Something like that. What are the things that are going to help you? Well, I've shown you the AMA website if you have nowhere else to start, or it might be talking to someone that you realise they might have a good GP. And then think about when you're going to review it so that you don't forget about it. A goal without a plan is just a dream. You have to have the plan to back it up and review it. Personal relationships. 1 walk with a friend each week. That sounds achievable. You might want to do that twice a week, but set yourself up to do it once a week. When are you going to do it? Give yourself a month to do it and see what happens. And reassess and see if it's realistic. And if it's not, modify that goal. And again, this is what you do with your patients all the time. Some of it will be career related. So in this particular one, it's a basic trainee, we build cases into it as well. But as long as you're taking all different facets of your life and building that into your wellbeing plan and scheduling it, if you don't schedule it, it won't happen. You'll forget about it. It won't get prioritised. Put it up on the fridge at home. Challenge you to try it and see if you had something like this and made one thing work, you would be that much further ahead. You have not failed if the other 4 things don't work. The fact you even attempt it means that you haven't failed. So hopefully I've inspired you to start an action plan or wellbeing plan now. There's a whole lot more tips that we can talk about if we had another hour. But thinking about those sort of ones, even if you take 1 or 2 of those things away that you could do as you go to work next week, and look at the response and share it with your junior colleagues. And if you get that mean registrar or someone on the phone and they're distressed, ask them if they're okay. That's it from me. Any questions? Side boxing looks funny. I have no idea why it's doing that.